I'm Dave Clarke. How are you doing?
Great, Paul. Wonderful to be with you. Thank you for having me on.
I am very grateful you are here because, as I said, I was talking to you just before we press record, but uh, I know you from my community really being, really finding your app that you contribute to, Curable, really useful as a resource. And if anyone's struggling with physical pain, it's one of the first things that gets mentioned.
Yeah, it's a wonderful application. They have interviewed me and a dozen or two of my colleagues around the world and taken all of our best ideas and put them into a very friendly user interface. And it's actually just been the subject of a research trial that I think was conducted in Vancouver, British Columbia, where they found even after 6 weeks, it had very powerful effects in alleviating physical symptoms. That's the goal of
Mm.
curable, is to alleviate pain or illness that has no structural cause, and it's been very successful.
Yeah, and this is you're here to talk about in respects is physical pain with no obvious cause. I mean, you're the author of a book called what's it? It's They Can't Find Anything
They
Wrong.
can't find anything wrong.
What a
Yes.
great title! What a great title! Um, yeah. So, can you explain a little bit about who you are and what you do, and what happens for someone when they're suffering with physical pain and there's no structural, obvious cause?
Yeah, I'm a consultant in internal medicine and gastroenterology, and I've been in practicing since the 1980s. And what I learned, fortunately, very early on was that there are a lot of patients who have no organ disease or structural damage to explain their pain or illness. And it can be symptoms literally from head to toe, anything from migraines to pain in the back to irritable bowel syndrome, which is one of my
Mm,
main areas of work.
okay.
And it's 2 out of every 5 people that come to their GP have this condition, and the GPs get very frustrated. They do the diagnostic test. They're looking for some kind of abnormality. They don't find it, and yet the patient has very real symptoms. So what's going on? Well, it turns out that the brain can generate pain or illness in the body in the complete absence of there being anything physically wrong, and the symptoms can be as severe as any other form of illness. They can go on for years or even decades. One of my patients was ill for 79 years.
Whoa.
It can produce severity that can put you in the hospital. The very first patient I describe in that book, They Can't Find Anything Wrong, was hospitalized at a prestigious university in the United States 60 times in 15 years with no diagnosis. She was actually cured after a 1 hour conversation with me, just to uncover what was going on. And what's going on is that there's a stress in the person's life. There's a significant issue of trauma or depression or uh, long-term impact of adversity in childhood that the individual is not fully recognizing. But it turns out we can diagnose those things if we know what to look for. We can bring them into conscious awareness. We can treat them successfully.
Mm.
And even the woman who had symptoms for 79 years made a complete recovery.
Wow. I mean, there's a lot to unpack there. Um, but first off, how does the brain create physical illness in someone? How does it actually do that? Because it does sound quite remarkable, doesn't it? Because you would think there must be a cause, but now we're looking at stress, and the brain is what, sending a message? Is it asking for help, or is there something else going on?
Well, the brain actually physically changes. There are studies now using magnetic resonance imaging that shows that the circuits in the brain, the pathways in the brain that process signals from the body, are actually physically changed by these stresses or traumas. And the brain actually is where pain is created.
Mm.
If you whack your thumb with a hammer, um, there's a damage signal that is then sent to the brain, and the brain actually has to decide, is it going to give you a pain signal there in your thumb or not? And it usually will do that, but every once in a while it's making a mistake and it's giving you a pain signal where there is no damage. Or it can decide that, yes, you have damage, but I'm not going to give you a pain signal. A classic example of that would be if you're running from a wild beast and you sprain your ankle. Your brain is going to decide that you don't need a pain signal at that point. You need to get safe from the wild beast that is chasing you. And once you're safe, then you're going to feel the pain of your sprained ankle. Happens commonly in military combat situations as well. So it's all going on in the brain, which is incredibly powerful. And under enough stress, it can send signals into your body that create changes as well. One of my patients had a completely paralyzed stomach. My very first patient where I encountered these ideas was averaging one bowel movement per month, despite taking 4 different laxatives every day at double the recommended doses. So her brain had almost completely shut down her large intestine. This came as a shock to me. I mean, I was 7 or 8 years into my training at that point, had no idea that the brain could do this to the body.
And what was it that began to occur to you to explore the brain's connection with the body? Because I guess because it's true, isn't it? The way that we're often what medicine's often promoted is to treat the symptom. And now there seems to be a lot of focus on that. But what was it about? What was it about you, uh, Dave, that said, "Do you know what? I'm going to look at this in a different light."
Yeah, it really was that first patient. We had done every conceivable test. Another university had also checked her out before us, and we were finding nothing. I was doing her exit interview. I was essentially telling her she was going to have to live with this. But I decided to talk to her a little bit more. I didn't want to just walk in, say, I'm sorry, you have to live with this, and walk out. So I talked to her about stress in her life. She didn't have any. She was happily married. She had 2 kids. She enjoyed her work in a bank. But then I asked her about stress earlier in her life, thinking, maybe 2 years ago when her condition began, something had happened. And she responded by telling me that she had been abused by her father. And it was actually sexual abuse. And this had happened not just once or twice, which would have been bad enough, but hundreds of times to her. And none of it, it had all stopped 25 years before. So I thought, this couldn't possibly be related. It was so long ago. And she was telling me this story in a very calm voice that you might, associate with reading a grocery list or something like that. It really seemed like, she had processed this horrible trauma, had moved on from it. But, I thought, this is something I really am not fully understanding here. I knew of a psychiatrist at UCLA where I was in training that had an interest. She was a consultant in medicine as well as psychiatry. She had an interest in situations like this. So I thought, well, maybe I can help this patient live with her condition a little better. And I sent her to Harriet Kaplan, who was the psychiatrist. Forgot all about her, got on with my practice and my training. And then I ran into Harriet in a lift 3 months later. And this was the lift ride that changed my career, because just to make conversation, I asked Harriet about this patient. And she said, well, I haven't seen her in a couple of weeks now. And I thought, yeah, it didn't really work out, did it? But she said, no, the patient is cured.
Wow.
But just by talking to her, roughly 10 sessions of counseling, and the entire illness was gone. She wasn't taking any laxatives. Her bowel function was completely normal. And I was just in shock. I mean, here I was, 7 years of training, and I had no idea that such a thing was possible. So Harriet, over the next year and a half that I was there at UCLA, gave me a basic framework for how to think about this. I wanted to be, a complete doctor. If somebody comes into my office with this problem, I want to know what to do. I never thought I would use it more than a couple of times a year. But it turned out to be 5 or 6 patients a week. And sitting here today, I've had experience with over 7,000 people with this kind of problem.
Wow. And have you met with sort of resistance to your approach as in regards to this possibly can't just be down to stress. There must be another cause to why a person is experiencing something physical this way.
People are skeptical at
Mm,
first. I mean, it is just as I was. It's hard to believe that how ill you can get from this. I uh, 7 years of training, and I had no idea that the brain could shut your bowels down or give you incapacitating migraines. Or patient I encountered recently was so ill with long COVID that she couldn't get from, she had to crawl from her bed to her bathroom and back, and that was all the energy that she had. The effects are profound, and um, it's so difficult to believe that your brain can do this. But I assure people that this is possible. I also assure them that I'm going to do an evaluation for physical causes of these symptoms. If somebody's got abdominal pain, I'm looking for ulcers, I'm looking for an inflamed pancreas, I'm looking for gallstones, but I'm also looking for stress. I want to make sure that I'm evaluating for all the possibilities, and people appreciate that. And they also appreciate that if I do find that it's coming from the brain, I'm not just going to dismiss them and say, hey, this is all in your head, go away. Um, there is a diagnostic and treatment process for this, just as there is for any other form of illness.
I love that. Again, it gets much more in the way of empowerment between you and the patient. That it's not just a lost cause, and I guess that sense of hope that because they've stated, I can't find anything wrong. There, that sort of idea that you're powerless. There's no autonomy with this, but to have that sense from you must mean a lot to them.
Yeah, it's really huge to have a diagnosis. So
Mm,
many of my patients have had this condition for years, some of them for decades, and they wonder if they're going crazy. They're hopeless. They're being dismissed by other doctors, and it's so unnecessary. This is why my nonprofit, which is now got a new website at symptomatic.me, is trying to educate doctors as well as the public that this is a condition that's just as diagnosable as any other. You just have to be looking for different sorts of issues. What kind of stress is happening in the person's life. Just that alone, um, you get a lot of diagnoses. One of my patients, very simple, but nobody else. He'd been to several doctors. Nobody else learned that he was only getting his symptoms when he was driving to work. When he
okay.
was driving home from work, he was fine.
Right.
On the weekends,
Yeah.
when he was not at work, he was fine. But if you don't know to look for that sort of thing, you're not going to find it. And of course, he had a stress level in his workplace that was off the scale, and the timing of that increase in stress level at work exactly corresponded to his symptoms.
I love that. We'll have a look at stress and everyday life in a bit, but when it comes to sort of historic stress, if you like trauma, you said it changes the brain. Is that what happens in the body for a stomach condition or a back condition? Is there is there a link between the type of stress a person experiences or physical illness compared to what type of trauma they've had? Is there some form of link?
Yeah, that's a great question. And most of the time, we don't see a direct connection. The same kinds of stresses and traumas and repressed emotions that produce physical symptoms can produce them in different parts of the body. The pain in the lumbar spine is very common. Irritable bowel, fibromyalgia, um, fatigue, um, migraines, pseudo seizures, visual disturbances, dizziness, ringing in the ears. All of these things, they can occur in one person and not in another. One person has dizziness and vomiting, another person has back pain, and most of the time we don't know why. have been a few examples where you can tell that there's a direct connection. One of my patients had stress-related pain in the sacral area, which is the bone right at the base of the spine. And she had actually been injured there as a 4-year-old.
Okay.
Her brother pulled a chair out from under her and she whacked her sacrum on the floor. And it hurt for, a week or two. And then, it went away. Now she's 54 years old. It's 50 years later, and she's having stress related pain in exactly the same place. And the brain forms pathways when pain is present. And when a stress-related pain occurs, sometimes it'll use those same pathways, even from decades ago. But the vast majority of the time, we don't know why one individual has a symptom in one place and not in
Okay.
another.
And go back to, do you think there is a message? Do you think the brain is stressed from trauma from the past? And the way of trying to get you to deal with it is to create something physical which gets your attention.
Yeah, it's really I emphasize that the body is actually your friend, even
Mm,
when it is hurting or having some other kind of symptom, that um, your brain is in a way using your body as a kind of a signal to tell you that there is a source of distress in your life that you're not dealing with. So that when people have a flare up of their symptom, or when they have been doing well for a while and then the symptom comes back, I urge them to start thinking about what's going on in your
mm,
life that might have triggered this. For a lot of people, the childhood adversity has had an impact on their present day life. There can be very stressful personality traits like perfectionism, like not doing enough to care for yourself, like excessive devotion to other
mm,
people, like being very critical of yourself more so than you would be of anyone else. There can be triggers linked to the past. Most commonly, someone who was toxic for you when you were a child, who is still in your life today, and you're having trouble setting boundaries with that person. And so they can be impacting you. Or there can be emotions from the past. A
mm,
lot of my patients still have anger, fear, shame, grief, guilt, that they have suppressed when they were kids, but it's still in there, and it's expressing itself via the body. So we look for that as well.
I think that, yeah, it's amazing. I think the way that, and I agree with you, the body is a friend. Um, I'm well known for treating people around the globe with anxiety issues. That's how I started all of this. And a big awakening for me was because I had really terrible IBS. Was in a way I was over focusing at the time on my mind, and I wasn't doing anything to help my body heal. And that was the kind of awakening I had, where I had to begin to treat it holistically, the anxiety I was going through, rather than just trying to think differently. And that led me to look, heal my past, but also I had to eat better, sleep better, drink water, do the things which basics. But because I wasn't doing them, that really did put my body under a lot of stress.
Yeah, it's when you're coping with sources of stress that you're not fully recognizing,
Mm,
it can have all kinds of ripple effects, both physically and mentally. Um, Many of my patients who tell me about their past, in the same breath, they're telling me, well, it wasn't that bad.
mm,
And I know other people have been through worse than me and they seem to be okay. And I really think I'm over it now. And, it's only natural that when you've been through a bad experience, you try to repress those memories and move on from them. But if they're still making you physically ill, we need to deal with them. And one of the ways that's helped my patients a lot is that I ask them to imagine a child of their own growing up in that same environment, or to imagine themselves a butterfly on the wall of their childhood home, and they are watching their own kid or another child that they care about trying to cope with that environment that they grew up in, even for just a week or 10 days. And how would they feel
Mm.
watching that? They're a butterfly on the wall. They can't do anything about it. They just have to watch the kid try to cope. And that frequently changes their perspective a lot. The experiences that they can rationalize or minimize when it's with respect to themselves, um, when they start thinking about it in terms of watching a child of their own go through the same thing, completely different story. The emotions are much more accessible with that exercise.
Yeah, I think that's a fantastic exercise. It is interesting when you start to dig into people's pasts and like, no, I had a brilliant past. I had the best childhood, and then you start to dig, and there's a resistance because it's almost like I don't want to be disloyal to my parents now. Maybe
Right.
one of them have passed, or they've both passed, or they're still alive, and now you have a better relationship. But it's almost like this. Oh, I don't want to say anything negative about them, but yet it's clear with a little bit of digging that there are some traumatic episodes even the best parents can pass on. It's amazing what children begin to pick up.
Yeah, and many of my patients, the parents wanted the best for their children, and as all parents do, but they kind of took it a little bit too far. They would add one more thing on top of their kids, that in the form of expectations after another. And the pressure level can build to a far higher level than the parents recognize. And the children at the time, and now the adult patient in my office, recognizes that the parents meant well. And how can you criticize somebody who means well? And how can you be angry at somebody that you still care about? That's one of the biggest challenges in making therapeutic progress for my patients, is to recognize that yes, you can be absolutely infuriated by people that you still care about.
Yeah, no, it's with a bit of help, it does come out. In a way, it's an encouragement just to be honest about what you were going through back then, just to release it and let it go. And it doesn't mean to say that we're bad mouthing anyone. Everyone's doing their best. It's all about being able to move on.
Yeah, and I'm just urging people to have an accurate recognition
Mm,
of what was happening and to give themselves a ton of credit for, having made it through. Once people fully appreciate the magnitude of what they endured, the next step is I want them to um, give themselves appropriate credit
mm.
for the heroic perseverance, honestly, that many of them showed as kids to make it through these experiences. And so many of them came out of their childhoods with an opinion of themselves that was far lower than it deserved to be. And I want to get that opinion
Mm.
up to the level that it does deserve to be. To recognize the um, energy and the quality that they had to make it through this. And another analogy that I make is um, that some of these home situations resembled being parachuted into the Amazon jungle as a toddler. Through no fault of your own, you find yourself in this highly challenging environment, and you have to somehow make your way out of there. But when you do make it out, you need to give yourself credit. You need to recognize you've done a tremendous thing here, and using that flip in your self-image as a platform then gives you the foundation for making changes in toxic relationships, setting boundaries in front of people that are causing problems for you, um, feeling like you deserve to take more time for self-care. Many of my patients are just so focused on the needs of everybody else in their world that they neglect to put themselves on the list of people they take care of. But when you appreciate your own quality, it gets a little easier to take time for yourself.
Yeah, it's one of those things which, when you're so used to putting other people before yourself, other people's needs before yourself, I guess the anger that that can bring up, the resentment, the lack of boundaries being kept, what will have an impact on your self worth. That must add a lot of stress, which in turn must again. I wonder if that translates to physical illness.
Yeah, absolutely. The more stress that you pile on, and the more different sources that it's coming from, sooner or later the body is going to feel the impact of that. So many of my patients they grew up in circumstances where other people in the household had problems, and as children, they tried to solve those problems, and they learned that it was their purpose in life to solve the problems and meet the needs of other people in their world. And it's only natural that as adults, they carry on doing the same thing.
Mm.
But they're leaving themselves off the list of people they take care of. One of the questions that I try to answer about my patients is, what did you learn about yourself as a kid that isn't true? Did you learn that you're a second rate or worthless human being? Did you learn that it's your job to fix everybody else's problems? And if people can see where those false assumptions that they have came from, it really facilitates making changes.
Yeah, I think that's a very powerful. There are very powerful reflective questions because it's amazing what you can carry that create that filter, that lens in how you experience the world, and you just think it's completely normal, but until someone begins to question it, then you're like, actually, it's not, is it?
Yeah, none of us has a parallel life to compare ourselves with. We only have the one.
Yeah.
And so when we're very young and the most powerful people in our world are um, teaching us things about ourselves that are false, we're going to absorb those lessons.
Mm.
If the world teaches us that 2 + 2 = 5, we're going to believe it for a long time.
Yeah, I absolutely agree. One thing I do love about some of the coaching that I do is I like to connect people to a future them who's much more relaxed, less stressed, able to adapt, and to really begin to create that as a level to begin to embody now. So it's a level to reach, but also to embody and act as if you are that calm, relaxed person now. And that seems to have quite a powerful impact when they've got something to begin to imagine that is possible for them on their timeline, that then they can be free of these limitations, free of their physical ailments and conditions.
Yeah, I love that. You're essentially helping people to see that there is a parallel person out there that they can aspire to be. So yeah, that's a wonderful goal to put in front of somebody.
Yeah, it becomes quite motivating. And also, because the other question I wanted to ask you about was, so we've got historic trauma creating stress. But also, I also say to my clients who talk about anxiety and stress, I say in the 21st century, what you're experiencing is absolutely normal for the way you're forcing yourself to live your life. Because some of the ways that they're living is very, very interesting, and yet they expect themselves to be calm, relaxed, focused, and energized, and feeling well. And yet, there may be no space to rest, no space to listen to themselves. It's a very noisy environment for them. There's all sorts of pressures, and yet it's sort of normalized, as in you should be able to handle this.
Yeah, it's always something I have to pay attention to, that um, people can be in circumstances where they don't have a lot of flexibility for self-care. If you imagine a single mother who is working full time and is trying to do childcare and is perhaps also taking care of other people in her family, the space that they have for self-care can be very limited. But I can still urge them to at least be aware of everybody's need for a little self-care, to
Mm.
carve out regular time, ideally every week, that has no purpose but your own joy. And what I'm looking for there is for the person to find an activity that is the moral equivalent of finger painting for a 4-year-old. You know, a 4-year-old with finger painting doesn't care how many pictures per hour they produce. They don't care about the quality of the work. They just know that they're having fun. And that turns out to be an essential human skill that a lot of my patients never learned as kids because of the environment they were in. But adults can learn it, and they learn it the same way children do, by just sheer trial and error. One of my patients was, I met in the early hours of the morning in the emergency ward. She had come in with sudden, severe abdominal pain. All the tests were normal. And it turned out she had an incredibly busy, stressful lifestyle. She was working full time. Her husband was working full time. She had been an athlete as a girl. She was coaching her 2 daughters in the sport. She was coaching other people's children in the sport. She was on the athletics club board of directors. She was driving kids to competitions and then, out of state. I asked her, "What do you do for fun?" And she had to think about it for a while
Yeah.
because there wasn't much. In her case, her athletic accomplishments as a girl had come with a price, which was that she had to practice before school, after school, and on weekends, starting at the age of 4.
Wow.
And continuing on up to age 18. She never really got to be a kid. She never really learned how to play. So her treatment was to take an afternoon every week, and fortunately her husband was 100% supportive of this, just to go out and figure out through trial and error what was going to be fun for her. And at first, all she could think of to do was go for walks in a park. If you haven't learned how to do this, it can be a challenge and it can take months. But after about 6 weeks, she came up with the idea of taking piano lessons, which was a surprise to her because she'd never done anything musical before, but she absolutely loved it. And that was the joy that she got every week. That was when the pain went away.
I love that story. That's amazing. I mean, that must, for you, that must, looking at what you're doing and the direction that you've taken, that must give you a feel good feeling that you know what you're having an impact on so many people's lives.
Yes, this was incredibly rewarding work to do, especially for people who had been ill for years. One of my patients, 55 years of abdominal pain. I saw him back before we had computerized medical records, and the volume 3 of his paper chart was 8 centimeters thick. I can only imagine the amount of money that was represented by all of the diagnostic tests and the unsuccessful treatments. But his issue went all the way back to being physically abused as a boy by his father, to the point that he walked away from home at age 15 and never saw his father again. And he started having the pain at age 19. He's now 74 in my office and still having the pain. And I got him connected with a class that we had at that time called Adult Children of Dysfunctional Families. And it was, 8 or 10 people with an instructor, 2 hours a week for 8 weeks. By the end of the class, he was free of pain.
I love that. Really, I'm hoping for people listening to this. I think this is such a powerful message of hope that if they're going through something that is physical and painful, to begin to think about where it could possibly have come from historically, or as in, what else are you adding to that with your, current lifestyle? For anyone listening to this, what would you say if anyone is struggling with any type of physical condition that they feel a bit hopeless with? What would you suggest?
Well, there's a great screening questionnaire, 12 questions on the symptomatic.me website. So that if people have got physical symptoms and they're wondering if these issues could be involved, That questionnaire takes less than 3 minutes. And the reason I mention it is that each question comes with a sentence or two of explanation, so that the meaning of a yes answer to the question will be clear to the person who's taking it. I spent, a lot of time crafting each of those questions and the explanations that go with them. And it's set up in a way that the more questions to which you answer yes, the more likely it is that you have one of these brain to body, or what we call neuroplastic conditions. Neuroplasticity is the capacity of the brain to change. And when you get to the end of the questionnaire, it gives you, the total score. And people are going to have not just the score, but a lot of insight into the issues that might be underlying this. And they can go on from there to focus on the resources that we have on the website. And, Curable is one of them that can help people start turning this around.
Yeah, I think so. I will put these details in the show notes. So you've got, so anyone listening to this, so you've got to do a scroll down. Dr. David Clarke's details will be there, as well as the website will be there for you to be able to click on and go through. And we're talking about stress historically and from lifestyle. What about stress culturally? From where we're located, or religion, or any other factors that could these have an impact on creating physical illness?
Yeah, I mean, they are additive to everything else. It can be, just as you mentioned, the stress of our lifestyle, the social media, especially for adolescents. Religion can be a factor. People who have very strong religious beliefs, sometimes they can be a source of toxicity for people. I've had a lot of patients who've grown up in households where the standards of behavior were set at an extremely high level because of religious constrictions that were really impossible to live up to for any kid. And so there was always shame associated with not living up to those standards. One of my patients had reached a point where he was so fearful that God was going to punish him that his stomach actually was paralyzed. When we did a diagnostic test on the emptying of his stomach, it didn't empty at all. And it was because he was just living in fear that he had transgressed against his God, and that God was going to punish him in a terrible way. And he was just paralyzed, literally stomach paralyzed with fear over that. So, religion is usually a force for good. It has literally saved some of my patients' lives when they found their way to religious belief. But in other situations, it can be a source of toxicity for people. And then there's also, we haven't mentioned trauma, just a terrifying or horrifying event that somebody has been through that can have an impact. A colleague of mine told me a story about a patient with unexplained symptoms for months and months, went to a lot of doctors. None of them asked her about trauma. When he asked her about trauma, she said, well, right before I became ill, I was a hostage during the robbery of a store. And for 40 minutes, she had a handgun pointed at her neck.
Wow.
And this had taken place right before her symptoms began. Again, we are not teaching our medical professionals to look for this sort of thing, and it gets missed all the time.
Do you think, talking about medical professionals, and I think this, and I'm so glad that we're having this conversation. Do you think there is an agenda from elements of the medical establishment not really to look at this, but to focus on treating the symptoms because that's where the money is, or that's what seems like the easiest approach?
Well, if your professional career is and your personal income is tied to doing procedures on people of one sort or another, then you have that financial incentive to look for physical problems. Let's put it that way. But the um, the outcomes from the neuroplastic approach that I've been describing are so positive that I think once people recognize it, they're going to embrace it, especially at the GP level, where there is so much frustration associated with these patients that can be completely flipped into a very rewarding professional experience when you're able to alleviate symptoms in people through these techniques. So, yeah, there is some opposition there depending on the nature of your practice, but overall, and I think in the United States at least, the insurance companies are finding that they can save enormous amounts of money by making the correct diagnosis, and I think the National Health Service will embrace this as well. That uh, the patients won't have to go through endless expensive tests that they have to wait months to receive, that they can be treated in a much more efficient manner and save the system money that it desperately needs to save.
Yeah, I also think. I mean, there is this sort of conflict, and maybe because this approach is so important that people might begin to trust the medical establishment a bit more, because there seems to be this distrust, especially since COVID. There's, the conspiracy theorists went crazy, and there's all sorts of things flying around online, and it just creates this natural distrust. Which I guess, if people are struggling with something physical, they don't know which way to turn.
Yeah, they don't. And there are all kinds of um, people manufacturing supplements and devices and offering various kinds of invasive and non-invasive treatments for people with this condition. They are all basing this on the idea that if you have a bodily symptom, it must be generated by the body, and people are desperate, and so that they are spending money on these supplements and devices and treatments, and they only have placebo value, and some of them are making a lot of money from this. There's a device called a spinal cord stimulator, for example, that in the United States costs $50,000. So you're probably looking at
Wow.
35 or 40,000 pounds, and it studies show that it only has placebo value. Um, and the treatment that I've been talking about, there is now gold standard randomized controlled trials research from all across North America, everywhere from Halifax to Los Angeles, that are showing tremendous outcomes from this. One example is the Boulder back pain study. They took 150 people with an average of 10 years of back pain, divided them into three groups. One group got their usual care. One group got a big injection into the spine. It was a placebo, and they
Mm.
told people it was a placebo, but the research in the past has shown that injections into the spine do tend to produce benefits. And then the third group got pain relief psychology, which is what I've been talking about with you today. And the pain scores all started at 4 out of 10. And you have to imagine, 10 years of this these people had been through. With the psychology group, the scores dropped from 4 to 1.
Wow.
70% of the patients, it was either 0 or 1 out of 10 in 1 month of treatment. And then they stopped the treatment just to see what would happen. Would the pain scores gradually drift back upwards, for example? But they didn't. They stayed down at the average 1 level for a full 11 months of follow-up. And they scanned all their brains, and they found that the patients who got the pain relief psychology, their brains physically changed in response to the therapy,
Wow.
whereas the other two groups, the placebo injection and the usual treatment, no change in the brain, as you might expect. So we've got really, really solid research backing this up now.
What 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 parts of the brain do change when someone's having, pain psychology, and they're having, they're addressing their trauma, and it's becoming less stress, which parts of the brain do begin to alter?
Well, it's the cortical areas. There's a study from Northwestern University in Chicago that shows that when people injure their backs, the areas of the brain that are active, have to do with pain processing, as you might expect. But then they followed them up, and a year later, most of the people had relief of their acute pain. They injured their back and it got better. But some of them, it went on to become chronic. It persisted. And they scanned those people's brains and found that that the activity in the brain had shifted to areas having to do with memory and emotion and learning. It had moved from the acute pain processing areas of the brain to these other areas that are amenable to pain relief psychology.
Wow. It's absolutely fascinating. I've got two questions from my community, by the way, that I wanted to get in before we wrap up the interview. One person said, "Why does physical pain feel less painful than emotional pain?" Do you have any idea? This is for them. I guess it's
Well,
their own perspective.
yes, probably an individual perspective,
Yeah.
but the it turns out that the chronic pain and the emotional pain um, activate the same areas of the brain.
Uh,
So there, are a lot of similarities between the two, and for that reason, probably why one would be more severe than the other in a particular individual would be just the magnitude of what they're dealing with. That if you've got um, a really powerful source of emotional pain, it's going to feel worse than a milder source of physical pain, for
mm,
example. But
yeah.
either way, it is the brain that generates all pain. All pain is real. Um, the severity of the pain is going to depend on the severity of the underlying trauma, whether it's physical trauma, um, as in whacking your thumb with a hammer, or emotional trauma.
Love that answer, and they'll be grateful that you answered that for me. And also, someone's put, as a mother of two, I can endure pain in a crisis. My question is: does everyone have their own pain limit, what they can endure, and is this a physical thing, or do we have influence on it ourselves with our mindset?
Oh, we absolutely have influence on it. Um, the we can set aside our own needs when the occasion requires it on behalf of other people. The classic example of this is in military combat situations where people do extraordinary things for the benefit of others, and their own pain, even if they're wounded. They don't. The brain decides that you're not going to feel the pain of this wound until you have reached safety. We're going to suppress the pain signal. The brain is going to decide not to have you feel this pain, so that you're going to be able to function um, in the dangerous situation that you're in. And it's not only combat. It can be any um, personal situation of high level of stress. Even just you know getting all your kids to their activities. I've got 5 grandchildren, and their
Right.
parents are always um, running around getting their kids to their various places, and they set their own needs aside while they're taking care of those needs. But when those needs are eventually met, then um, the healthy approach is to make sure you put yourself on the list of people you take care of.
I love that answer. Thank you so much. I think there's a lot to be said about the mindset. I think William James' as if principle, where you like with the army, etc., where you are acting as if you are strong and pain free. I think the brain and body seems to have a response to that, which can look and feel quite positive.
Yes, and that's what I encourage my own patients. When they have been through a challenging home situation as kids, for example, I want them to think about that as if, like I say, they were parachuted into the jungle as a toddler through no fault of
Mm.
their own. But they should feel very good about themselves for having made it through that, so that it's not really even an
Mm.
as if, it's an accurate recognition that they have done something extraordinary, that they have shown heroic levels of
Yeah.
perseverance in many cases.
Yeah, I love that positive reinforcement. Um, as just before we wrap up, what's the one message that you'd like to give listeners of this show about your work, or if they're struggling with any type of physical pain, what would you like them to know?
Very simply, to boil it down to the essentials, the brain can cause any level of pain or illness in the body, even in the complete absence of any physical issues in the body. And the corollary to that is that effective treatment is available.
I love that. I love that. Dr. Dave Clarke, thank you so much for coming on to the show. I could talk to you for ages. I know that we have to end, but I have so many things I could
Paul,
learn
you and I are absolutely on the same wavelength, and I really appreciate it.
Yeah, I just love what you're doing. I absolutely love it. So, thank you so much for what you are doing. Thank you for for what you're putting out into the world and how you're helping people. Please do check out Dr. David Clarke's website. I will put it into the link down below. So all you've got to do is scroll down. Please access those resources. Please do the 12-step. 12 is it 12 questions?
12 question
Yeah.
quiz. Yeah.
Yeah. So find out where you are and know that there is hope for you. And I just want to say thank you so much for listening to the Mindset Change podcast. It's been a pleasure to have you here listening with me. I look forward to connecting with you in the very next episode. Have a wonderful, peaceful, and present day.